all. Thanks so much for watching Making Healthcare Work for You, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Bastion Health. We talked to Reza Amin, who is the founder and CEO, and Dr. Justin Houman, who is their medical director and a urologist. And it was really an interesting conversation about, I really thought, the gaps in men's health. I didn't realize that there was such a need for men's health, for this kind of focus on men's health. I didn't realize that they neglected it to the degree that they do. They said that sometimes men don't see their primary care doctor for the first time until they're 50 years old, which was mind blowing to me, because something would prompt you to go to the doctor between the time your parents are taking you to the pediatrician and the time you're 50. I mean, that's a long period of time to completely neglect yourself. And it was interesting. Justin, the medical director, said that he really thinks of this men's health as the check engine light, that, getting care for fertility can sometimes unveil other problems that might be blood pressure or cholesterol or something else that could be contributing to the issues with the infertility. And you can solve these chronic issues or treat them years before they might ever lead to something like a heart attack or something else that's going to be really, really life impacting. So it was really interesting to me, because I just did not realize there was that big of a problem with men not seeing doctors. And Reza kept saying, men are not proactive. Men are not proactive. And they often come to them either through their wife or partner. And then also they work with employers, which I thought was pretty cool, because then people can order that through open enrollment or on a portal, and it's still discreet, but they're getting it in front of people so that they know it exists, because that is a challenge. I said, if these men aren't proactive, how in the world are they finding you? What would ever possess them to even go look for you? So I think it's interesting that they're, marketing some to women in cases of fertility, and then also working with these employers. So they are getting it out there, which is also helping solve some of the gaps that exist in access overall. We all know how hard it can be to get an appointment during pandemic times and how that's really changed everything. So I really liked it. I wasn't expecting to learn the things that I did today about the needs in men's health. Apoorv, what were your takeaways?
Hi, Stephanie. Yeah, thank you. It's welcome to the world of male, medicine, or the neglect of it. Unfortunately, sometimes something happens to men between the ages of 18 and maybe 50, maybe 60, where they think they're just invulnerable and they don't really need to get any ongoing care, which is, of course, not true, but that's somehow how the biology is set up. They don't really have a lot of symptoms. A lot of the things that are going on with them are sort of smoldering, and there's not a good setup. They could have cholesterol issues, heart issues, diabetes, many other issues going on, and unfortunately are neglecting those issues. And so that's the promise of companies that we're talking to, which is digital health, that ultimately they can help through convenience, through improving access, through privacy, confidentiality, and through improvements in pricing. They can make care much more accessible to men in a way that somehow hopefully make it much more appealing to them. So that still remains to be proven. I think that there's a lot out there that maybe says men may be more inclined to access care through telemedicine because it is more convenient. But at the same time, are they still going to be able to get the care that they need in the numbers that they need to in order to be able to really tackle some of these problems? Certainly the issues that Bastion is dealing with in terms of infertility and prostate health, you can say that these are undiagnosed, underdiagnosed, not diagnosed early enough types of conditions, which could lead to longer term problems. So, kudos to our guests for trying to tackle this. But I'll be really interested to see long-term, whether these kinds of solutions ultimately help solve the access and quality problems.
Absolutely. Thank you all for tuning in, and be sure to watch the full interview if you haven't already. We'll talk to you soon. Bye-bye.
Bye-bye.